All right. Hi, everybody. I'm Andrea slash Drea. I'm just making a video again because I'm upset with the Vimpat slash Lacosamide um, medication for, seizures because it's a controlled substance versus non-controlled. I also take Keppra, so getting Keppra is way easier than getting another, medication bottle for Vimpat slash Lacosamide. So that's going to be what I'm talking about today. So I wrote down a whole bunch of notes, researched some stuff. Um, so just before taking the medication, Vimpat slash Lacosamide, um, it says tell your doctor if you have ever had like heart problems, kidney problems, depression, mood disorder, drug or alcohol addiction, nerve problems, caused by diabetes. So, it's basic things to, watch if you have before taking any seizure med or medication. Um, so basically, I say Vimpat is a pain in the ass. I live in Arizona, so I don't know if it's different with other states, because here I can only get it once a month, very strictly. Um, so that's why I want to talk about this because I commented on one of the pages I have on Facebook, and some people don't have any problems with it, and some people do go what I go through. And it's been 4 years, and it's just such a pain in the ass every month because it's hard. I mean, the two substance categories are a controlled substance and a non controlled substance. So, I'll just start from here. So some controlled substances are going to be like Adderall, narcotics like oxycodone, fentanyl, morphine. So I feel like it doesn't, I shouldn't even be in that same category. Vimpat to control seizures? Like, seriously, Kepra's, good to get when you need. I just don't understand why the Vimpat is going to be such a pain in the ass to get. I've cried so many times, you guys. I call every month because sometimes it's just such a hard schedule to get them on time. And the number one thing you get as advice or rules to take your medication no matter what. Take your seizure meds because you want to control not having seizures. So it is a struggle. It's a pain here in Arizona, at least for me. Um, I have some friends that also have like seizure problems, but they neither of them take Vimpat. So um, I am the only one, that struggles right now that I know at least. Um, so like I said, I wrote down some notes. Um, so okay, yeah. So I did write pretty much a lot of notes. So some controlled substances were what I read with the Adderall, narcotics. Um, and then it would be, this is the same classification as like cocaine, heroin, and meth. Those are obviously, you don't do those. So that's why getting a controlled substance to control your seizures, that has nothing to do with, the heroin and meth. That's what I believe. Um, so it also means that the possessing of any of those medications without prescription, the medications as far as the Vimpat, it's a felony if I have one and someone that I know has seizures that need a seizure med, I would get in trouble for being here's a Vimpat, trying to protect the friend I have seizures. Like, I'd rather give them a Vimpat than not give them anything to protect a seizure. People that don't have seizures don't understand. It's hard. It's hard. It's my 4th year. This month it's my 4th year having seizures, having epilepsy. See. Yeah, well, I mean, my thing is, if there wasn't a problem getting the medication, it would be so much better. I mean, having a pain in the ass medication is such a hard time. I mean, 4 years every month is about always is hard. And you can't get an auto refill. I've tried to start auto refills. They don't allow it. So, I mean, it's a hard problem. So I also wrote down some stuff. What is classified as controlled drug? Uh, it's a controlled substance by the government because it may be abused or cause addiction. Controlled drugs are drugs that are subject to high levels of regulation as a result of government decisions about the drugs that are especially addictive and harmful. This is to protect your seizures. I don't know who just takes Vimpat. I don't know if that's a thing. I'm on 3 medications. Vimpat is just one. So it's hard for me to believe, the people that just have the Vimpat get a hard time refilling this. I'm thankful I have other seizure meds, but like, there's no easy time to refill a Vimpat unless you do. Props to you. So the DEA is a Federal Drug Enforcement Administration. It's Controlled Substance Agreement. So the purpose of the agreement is to provide you with the requirements, risks, and benefits for ongoing treatment using controlled substance. The control applies to the way the substance is made, used, handled, stored, and distributed. So the controlled substance includes opioids and hallucinogenics and depressants. And I'm just like thinking that shouldn't even be the same with anti-seizure meds that are supposed to protect ourselves, protect family that needs to help you, and just the life you live. I had a freaking 4-year struggle already, and it's always something. Okay, so a health provider may prescribe a patient up to 3 months supply. However, approval of such prescription requirements the specific codes. So I learned about these codes as I looked it up. There's 6 codes. Code A is related to patients with panic disorder. B is for patients with minimal brain dysfunction. C, chronic debilitating neurologic conditions. D, for relief of pain in chronic and incurable patients. E, related to patient with narcolepsy. And F, related to patients with hormones deficiency and those with like breast cancer. So that's what I discovered. So basically with the DEA, that Drug Enforcement Administration, federal agency that enforces drug laws, founded in July 1st, 1973. That's 51 years ago. In the USA. Let's see. It's really mind-blowing with the research I've done. So the DEA, with those that I have just read, the 6 of the codes. Computer-generated sequence allows other healthcare providers, such as pharmacists, to verify the validity of the prescription to prevent fraudulent dispensing of controlled medication. Those are right there. Healthcare providers must be familiar with different codes and regulation on a federal and state level. Avoid drug overprescription and diversion. I'm saying these things because I don't think it relates to Vimpat / Lacosamide, that those are specifically for epileptic people or just, seizure people, to help them not have to worry about having more seizures. Like, I don't know if you guys want to comment some facts that you know, let me know. I've definitely been researching some stuff like all day and past 4 years of I don't understand why it's controlled. It just shouldn't even classify for epilepsy, for seizures in general. So what and when the earliest you can refill a controlled substance? And this is what I have that is, happening to me. I'm in Arizona, in the USA. If you have a medication that follows the 28-day rule on a 30-day supply, it means you can get a refill no earlier than 2 days before the 30 days are up. This happens to me so many times in the past years. And, refilling it on time because I put an alarm, I put it in the calendar. Sometimes it doesn't add up and you can't, time just messes up and it struggles. There was one time that the price of the Vimpat says it's like $1,000, and my mom was trying to help me and she almost paid that $1,000 because she wanted me to have my medication. And at that point, I was like, I don't want you to pay $1,000 for a freaking 30-day supply of med. That's supposed to help me. It's really frustrating. If you're going through the same problems, just know you're not alone. I'm here to support and help any ideas or anything that I did. It's devastating, People's schedule will have a hard time with it by needing it firmly. Yeah, because, everyone has a different schedule. It's probably really hard. No automatic refills, unfortunately, too. I try to do that where it can just start refilling for you when you need it. For me, that doesn't work. I am so thankful for if anyone has that, thing that you can do. Just have it refilled when you need it. So basically, seizures are due to sudden, temporary, abnormal electrical signal firing in the brain. Seizures lead to changes, behaviors, movements, level or awareness, and feelings. Epilepsy occurs when you have recurrent seizures. For most people, like myself, medicines are effective in managing seizures. Allergies, for me, that I've had are the trileptal and Zogran. Those two gave me hardcore rashes where I had to go to the hospital and stay there for a few days for them to help me out. The Lacosamide that I take is 200 milligrams twice a day, and they had me take that from the very beginning, so I've never taken a lower dose or anything. It's just one in the morning and one at night. I don't understand why, the people, pharmacy, federal government, that they think that that should be in control when it's a pain in the ass to re-get so that you can take it so you don't worry about having more seizures. So that's all I wanted to put out there, kind of just, put out what I'm going through at least, because if it's going through you too, you're not the only one. Can ask me for any advice. I will try to give any answers or information. Again, my name is Andrea, or Drea for short, and Thursday, September 19th, 5:30 for me p.m. And I will talk to you guys later. Thank you. Bye-bye.